the things you had mentioned in one of your reels was that, even 30 years ago, 20 years ago, we did not have a laundry list of autoimmune conditions as we do today. And as you and I both know, the research is clear. It leans greatly towards women, me included. I know for you, you started to see the warning signs of this happening. And I really want to hear a little bit about that story. But I was curious, what have you seen in the research you did for the book, and really what you've seen as a doctor, as a practitioner? What has shifted in the last 30 years? Was it that we just did a poor job of identifying? Was it that we just live in a just more toxic environment? I'm just curious, kind of what has been your underlying or kind of your viewpoint around this?
It's a great question. I don't know the answer, but I've got a few ideas. I feel like certainly we live in a much more toxic environment. We've got more toxic stress than we've ever seen before. And I think the pandemic in some ways really brought that to the forefront. We're seeing, we're seeing exponential rise right now in autoimmune disease after the pandemic. And so how much of that is related to the stress of the pandemic, the, shelter in place, the isolation, the loneliness, how much of it is due to spike protein? It's a little bit hard to say. But I think when you put together our food getting more inflammatory, toxic stress, more trauma, and you combine that with some triggers like perimenopause, pregnancy, infection. Those are some of the root causes of why we're at this place of seeing an exponential rise in autoimmune disease. And, what I was saying in that reel is that when I went through my medical training 30 years ago, we had a few, Hashimoto's, thyroiditis, multiple sclerosis, type 1 diabetes. Now we have more than 100. And the list is growing every day of not just classic autoimmune diseases, but other conditions where the body attacks itself. Things like endometriosis, things like adenomyosis, which I had, things like breast implant illness, things like long COVID. So we're seeing, the rise of classic autoimmune diseases, more than 100, but also more, what I would call more non-classic autoimmune diseases.
I want to take a step back in your own journey when you kind of started to see and notice some changes, and how, when you started to, one, kind of identify, and I don't know if it was labs or, I would love to get into that a little bit, but then you kind of stepped out and had that 3,000, view up. What you started to identify kind of as not only your root causes, but root causes that you are seeing playing out. Again, this is a women's health podcast. I always tell everyone I serve everyone by serving women. So it's specifically connecting to women.
Yeah, well, the root causes are interesting. So if we start first with, what does the science tell us?
Mhm.
The science tells us, and this is through the words of Alessio Fasano, who's a pediatric gastroenterologist at Massachusetts General Hospital. He says there's 3 things that you need for autoimmune disease. Number 1, a genetic predisposition. Number 2, increased intestinal permeability. And then number 3, a trigger. So the triggers I got a little ahead of myself in talking about some of the triggers because, for some people it could be they go through a divorce. For some people it could be a pregnancy and being postpartum, which is a really common time, especially for Hashimoto's to flare. For some people it could be an infection. So we talked about COVID, it could be other things too. So those are the root causes. And then I would say there's all these other levers that we want to consider, including the food that you're eating. And I know you're so careful about the food that you eat. You had your Hashimoto's basically in remission, and I hope we get to talk about that. But it's also, these other aspects of the way we live our life, the way that we eat, move, think, feel, supplement, relate to others. All of these things are factors that can moderate your risk of autoimmunity.
Absolutely. Sorry, I can hear my toddler screaming downstairs because he got hurt. And so it took me out for a second. I apologize. Because I was like, what kind of, you hear that first cry, and then the subsequent one, the level of intensity is kind of defining what level of, did he jump off the stairs and didn't land? So I mean,
You and I, so this is a beautiful moment because you and I are both mothers.
yes.
And a big part of the way that we are in the world has to include our mothering. It has to. Like, there used to be a way that I would sort of pretend like I'm not a mother and I would just be like totally present for a podcast and it didn't matter what was happening in the background. But I don't think that honors all these roles that we're trying to manage, which
Yeah.
is part of the story. It's part of, kind of the stress of really needing to be in two places at once, right? Like tending
Absolutely.
to your toddler and also being on this
He's
podcast.
present. You know how excited I was? My husband saw, we're all in each other's calendars, and he's like, I was like, I'm interviewing Sarah today. I was so excited. He's like, I know. And, and then my son got home 5 minutes prior, and I can just hear him stomping in his little way up the stairs looking for Mama Titi's. So he was, and so it was so cute. But I was like, and in the most gently kind of impatient, I try to not be, I was like, Mama's running to an interview. And so trying to get out of my room to get to here. But no, yeah, it very much, it needs to be a part of the landscape. And we definitely get to honor that process. Because you're right. I think it's, if we kind of try to I don't think it's possible to compartmentalize. And I think that is, a part of, why women do struggle, is trying to do their best to compartmentalize all of it. And it's really not, it's not doable,
Well, we can't do it like a man.
No.
And I would say, the traditional masculine is to compartmentalize. And the more that we do exactly what you and I are doing and what we're asking our followers to do, which is to tend and befriend, like talk about your toddler and what you heard in the background, bring it into the conversation. Like, let's be super friendly toward it and let's tend to it together. Like, that is deep feminine goddess behavior. I love it.
I love it too. And I'm so grateful to get to do it with you. That is for sure. One of the root causes, and I agree, all of those feel very in alignment and with what the science says, but then also the triggers. But one of the triggers, and I'm so excited to dive deeper into this, it was the trigger I knew that was true for me, which was the trauma and the stress. Well before the Haji diagnosis, I had been dealing with stress, chronic fatigue issues. And so I feel like that was, the Haji's was really on the heels of a lot of that. And sure enough, that diagnosis came about 4 years later after really addressing the chronic fatigue piece. But I would say that although I made changes, in hindsight, they probably weren't, I probably didn't dig deep enough into those traumas to really heal some of those wounds. And that it continued to manifest until voila, there I was with kind of that next level diagnosis. And even still, especially becoming a mom, it is all shuffled and shifted and changed. And hence why, postpartum, although we were well medicating me with thyroid medication, and so I felt really good. I was watching my antibodies steadily go up over the course of that postpartum journey. I mean, I kept a close eye on them. We looked at them every 90 days, and I did a lot of what I would consider to be very healthful lifestyles, but it wasn't enough to slow them down up until I was fully done breastfeeding, and I was able to really focus my attention with supplementation that I simply couldn't take, what I didn't feel comfortable taking while I was breastfeeding my son. And so I wanted to connect in with that root cause of that underlying trauma, the kind of the default way that many of us, or at least I'm speaking for myself, that I have operated, which is a very familiar patterning of kind of a slightly default survival mode or default efficiency or default just being the person who I always say, if there was a horse to bet on, it's me. I'm the horse. I'm the horse. I am responsible. I am reliable. I follow through. Like I check all the boxes that anyone would love to partner with. And people are like, how is it that you can da, 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 da? And I'm like, it's trauma. It's full on trauma. It's
So good that you recognize this because, especially for women who are high achieving, who are self-reliant, or maybe hyper independent, these, sometimes these are trauma behaviors. Sometimes the way that we run, kind of that horse race quality to the way that we work, is a learned trauma reaction. For me, and maybe for you, maybe for some of our listeners, there was a certain way I had to be in the world as a kid to receive the love and attention that I most wanted. And that included performing. It included, taking care of things that had to be taken care of in the house, doing more chores than other people. It included getting the straight A's and getting the accolades associated with that. And so connecting those dots and realizing that there's a way to be in the world where the cost of your behavior and the way you conduct your life and its effect on your health, like we can measure that and we can actually improve. We could, set up some systems so that we're not over functioning, because it's the over functioning that really causes a lot of problems. I mean, you mentioned a couple of triggers. Certainly there's the trauma, and it's such a common trigger for people with autoimmune disease. We know that having an elevated adverse childhood experience score is associated with a greater risk of a lot of chronic diseases, heart disease, cancer, alcohol use disorder, and especially autoimmune disease. But there's also what happens in pregnancy. And you said you were tracking your, sounds like thyroid peroxidase antibodies or anti-thyroglobulin antibodies, and you were seeing them rise. And, you have to find your way. Low dose naltrexone is still relatively new. I wouldn't take it when I'm breastfeeding because I just don't think we've got the safety data. And pregnancy is really kind of tricky because you've got the sperm that, meets the egg and fertilizes the egg, and then half of the genetic material of this beautiful fetus that's growing is not you. And so your immune system has to adjust to that. And sometimes it backfires and it leads to this flare of Hashimoto's, the rise in antibodies, as you described.
Yeah, it's a really fascinating. Women's bodies in particular are just so profoundly miraculous, and what we do to bring life into this world, and then what we do as mothers to decide for our children what is the right thing. As I watched those numbers rose, and I wasn't willing to get back on low dose naltrexone until I was done. They weren't rising out of control, but I was keeping a good eye on them and doing all the things I could do. At least I felt like I was doing. But the decision was to breastfeed him as long as I could. So that was a decision I made. That was a choice until the choice was to get back on the LDN, the low dose naltrexone. And now my levels are down very, very low. So we're, here we are on the other side of things, but it's still something I'm always going to be monitoring, for the rest of my life. It's really interesting. And this probably won't be the first time or the last time I'll be on low dose naltrexone either.
Well, you're recognizing one of your vulnerabilities. So one of your vulnerabilities in terms of the downstream consequences of trauma is your immune system. And that's so critical. I mean, the other thing is your genetic predisposition to have Hashimoto's may or may not have been inherited by your son. And so the longer that you breastfeed him, the better you set up his microbiome, the better you set him up to have a lower risk of autoimmune disease. And men, for the most part, have a lower risk of autoimmune disease than women do. But I also have a lot of male patients who've got Hashimoto's. So it's not that we don't see it, it's important for men too. And hats off to you to do the unselfish thing of breastfeeding your son as long as possible. And, that's kind of the first taste that a lot of mothers get of these competing demands of your health. Because for your health, you probably would have gone back on the low-dose naltrexone versus his health. And you chose his health. So you did the honorable thing. You did the thing that is unselfish. And then you had a little catch up that I imagine you had to do to reel in those antibodies and kind of get back to a place of remission.
Yeah. And one of the things we were talking about was, I was talking about that menopausal transition, perimenopause, and how so often we don't know we're in it until we're in it. And I think one of the reasons, and I'd love for you to talk about this as well, because I have a feeling this is a lot of what you may see within your patient base, is that there are competing health concerns that are kind of running in tandem. For me, there was a trifecta of postpartum. So hormones weren't even really back online. My period had barely come back, 43. So here we are. Antibodies are happening. And so there's a lot of, and I found myself, I was telling you, I spent the last year in 2023 going down so many rabbit holes. I drew so much blood, it was pretty insane. And kind of I told you at the end of it, a lot of what I realized was that I was very much in what the window of perimenopause is. I was very much in that window. And so I was like, oh, this is really, this is it too. And so this is, I would say, my an area of expertise, but I found myself chasing down all these little avenues and then like, oh, here I am. And so I was curious, is that a lot of what you'll see too, is that, maybe someone has, they've got a gut issue, or maybe it's chronic fatigue issues, or maybe it's, kind of antibodies for Hashimoto's, and we're starting to see low thyroid function. And they're also 44 or 45 years old, and they're really in it with fluctuating estradiol and progesterone levels.
Well, I take care of a lot of perimenopausal people. I also take care of executives and professional athletes, and they're not dealing so much with perimenopause, but I mean, you described it perfectly because being postpartum, when you deliver that baby, when you deliver the placenta, your hormones go from sky high down to almost nothing. And that's a perimenopausal state, regardless of your age. Like you could be 24 and that period of time that you're breastfeeding and you're postpartum, whether it's 6 months or a year or 2 years or longer, that is a perimenopausal state. And then you juxtapose, pretty much anyone over the age of 35, that's perimenopause. Like the symptoms you're having, just assume they're perimenopausal until proven otherwise, right? And so we know that when you shift from premenopause to perimenopause, there are dramatic changes that happen with your innate immunity and with your adaptive immunity. People think that it's just their ovaries that are kind of going wonky and they're not making as much progesterone as they used to, and their estrogen is fluctuating wildly and then not making enough. But the story is much broader than that. Like you're becoming more insulin resistant. You're also changing your immune system. And when we think about the stress response in the body, there's the Pine Network. And the Pine Network is where really most people are vulnerable in terms of the effects of stress and the effects of life cycle changes. And Pine stands for the Psycho-Immuno-Neuroendocrine Network. So you want to think in terms of the Pine Network. What's true for you is that the immune system, is where your particular vulnerability is. So, that's something, as you said, I think of it not as a burden, but as sort of this divine message that you've decoded so carefully over the years. And so you have to kind of keep in touch with it. You've got to kind of befriend it, be tracking your antibodies once a quarter, as you described. And be open to the possibility that you want to do these N of one experiments to see what's going to be the most effective for you.
Mm. Yeah, I was thinking about as you were talking about the Pine system, and the not even the immunity changes, but the neurological changes that so many women go through. I think kind of that defining little thing for me, as I've shared here on the show, was the perimenopausal rage. And I'll tell you, it does not go well with potty training. And just, one of the commitments I made when I tuned into who I needed to become for my son, who's a beautiful little light being, was to always show up with compassion and love and kindness and empathy. And that is what he's received. My husband, maybe not so much. Maybe he hasn't received as much of that. But that was kind of just like tuning into the neurological piece and knowing that so much was shifting there as well. I wanted to shift the conversation a little bit into kind of looking at that broader picture, but more around the lines of trying to figure out, diagnostically through labs, if this is something that we're dealing with. You and I both know it takes an average of, 4+ years to get a definitive diagnosis. And so many people have to see multiple doctors and just go down the rabbit hole until they finally kind of get this answer. And obviously then there's a whole nother, the solution and the plan is a whole nother ballgame. But I would love for you to speak into, particularly, let's say, in this demographic of women who are in the menopause transition, one of the things I love that you speak of is really a timeline of labs over time, so that you've got a baseline standard. And not only are these metabolic labs, and this is fasting insulin and blood sugar, but also we're looking at C-reactive protein, homocysteine, maybe just a lot of the different labs that are really going to show us, or maybe start to highlight if we need to dig deeper.
That's right. I think you described it so beautifully, the frustration of having these mysterious symptoms and not getting a clear diagnosis. And we know the average is that you see 4 to 6 doctors before the correct diagnosis is made. And as you described, it can be years and years of suffering and being told, maybe dismissed, or you're just getting older, and no one bothers to check the labs. So we definitely want to check the labs, because there's a timeline here. There's a spectrum from normal, healthy tissues, normal, healthy body, to autoimmune disease like Hashimoto's thyroiditis. And there's this vast middle ground where your immune system is signaling that things are changing, and you can measure it.
Mhm.
So, as you described, I would say for anyone who's listening who doesn't have an autoimmune disease, like, get a panel, check it once a year, where you're looking at your complete blood count. You're looking at your neutrophil to lymphocyte ratio. And I talk about these in the book. You look at your high sensitivity C-reactive protein. Maybe you go to the next level, kind of more advanced, where you're looking at antibodies. You're looking at anti-nuclear antibody. You're looking at thyroid peroxidase antibody, anti-thyroid globulin. These things that your immune system starts to produce when you lose tolerance, when you can no longer distinguish normal, healthy tissue from kind of foreign invaders, which is what your immune system is supposed to do. And your immune system has this case of mistaken identity, and then starts to attack your normal tissues like your thyroid. So you can measure that. You can measure these antibodies. And I think, what I hope is that our listeners feel empowered to start doing some of these laboratory tests, so that you can track them over time. And you can see some of these early subtle changes, like I did. Like, I found that I had positive anti-nuclear antibodies, not just a little bit, but like pretty high levels of anti-nuclear antibodies starting about 5 years ago. And that's what got me to start thinking, okay, there's this really vast middle ground that takes about 7 to 14 years to shift from healthy to autoimmune disease. And I want to do everything I can as early as possible to try to reverse that.
Agreed. And so that's what I wanted to speak into, what should we be looking at? I think, my experience with working with a lot of the women in my community is that they either have to really go to bat for those labs, or they'll need to go out of pocket to get some of them ordered as well. And so I just want to I mean, I think advocating for this, for how important it is to just see where you're at, and then, and then move. I was in my, I do an annual every year, and I run labs. Otherwise I can run them myself, but we pay good insurance, because of my son. And I had my list, including ApoB, and my my lipid labs look stellar. My fasting insulin is at a 3, and my doctor is just like, I can't run an ApoB. She's like, you don't have, your lipids are not nowhere near out of range, until you give me reason, I cannot order it. Like, I'm not, it was really fascinating. So we just ended up having this really nuanced conversation about how, she also won't run a fasting insulin. I obviously go and do that somewhere else too. And so it was just interesting to kind of just get into the nitty gritty of, what I could get and what I couldn't get. So I was negotiating, and we've had this so many times. We've been down this road, and, sometimes I can get other labs, other times I can't. But it's a really, to me, it's kind of it's a fun conversation, because I know what I'm getting involved. I know the conversation. I know, I know that I can go and resource these labs out somewhere else. But it's a lot of us, I know how hard it can be to advocate for something, especially if you don't know what you're really advocating for.
For sure. And I'm glad you raised this point with your primary care doctor, because so many people right now are like nodding their heads, like, yeah, I can't get an ApoB either. And it's the mainstream medicine approach, because they wait until there's a problem before they'll run a test like ApoB, which is critical. ApoB is critical to be able to track before there's a problem. You don't want to wait until you have dyslipidemia.
Preventative tests.
Right. So just as you, and all of the access that you have, all the resources that you have, you're struggling to be able to do this within an insurance-based system. Of course, a lot of people are struggling with this. The good news is there are a lot of places where you can go to get some of this testing, places like Insight Tracker, Wellness FX, but it requires disposable income, and not everybody has that. But you can make some estimates based on your LDL cholesterol. You can make some estimates based on some of these other measures, and you can start to implement some of those levers that we talked about, kind of the food-based choices, the lifestyle-based choices, creating healing states of consciousness. You don't have to spend hundreds of dollars to do that.
Yeah, I agree. I just wanted to speak into, what are, and we can get a lot of information from the baselines. Most doctors will run a C-reactive protein. There are labs you can absolutely get your starting place and can give you a lot of information. I just wanted to speak into, as if someone kind of felt like they were already going down the rabbit hole and trying to get the diagnosis, like, well, maybe what's the next step in labs? And I know the book goes deep into it. I just wanted to I always love to bring it up in a conversation, just to kind of remind all of us, we really do have the power to do so, to really kind of request in a really sweet and wonderful way, see if we can make a case for some of these labs as well, if they're, if we can get them covered under insurance. And yes, that there are so many other wonderful places that we can go and get them run too. The other thing I wanted to connect the dot around, we've talked a lot here on the show, you and I, about our metabolic health. And I'd love to, that's a big part of what I'm often educating my women, insulin resistance being one of the root causes for, name a thing. And I was curious, how much weight does having good metabolic health play here when we're talking about immune system deregulation?
Oh, it's huge. When I talk about the PINE network, psychoneuroendocrine network, what we know is that there's crosstalk between these different systems. So I would put insulin resistance probably under the E, under kind of this endocrinologic change. We know that For people who have adverse childhood experiences, once again, they've got a much greater risk of glucose problems, much greater risk of downstream metabolic consequences, higher risk of type 2 diabetes, higher risk of prediabetes, which I have. And so there is this way that if you look at cardiometabolic disease, if you look at, coronary heart disease, or the way that blood vessels are affected by insulin resistance, the way that it kind of damages blood vessels, and that happens at a lower blood sugar than it does in men. So in women, having a fasting blood sugar in kind of the 115 range, that actually starts to damage our vessels earlier than it does men. So understanding that the way that your blood vessels are affected by insulin resistance, some think of that as an autoimmune disease because your body is attacking your blood vessels. It's just sort of the consequence of insulin resistance. So, in some ways, you could say insulin resistance is a risk factor for autoimmune disease, for your blood vessels starting to be attacked by your body, depositing plaques, leading to microvascular disease as well as larger blood vessels. So I would say this is a critical part. We also know that as women shift from premenopause to perimenopause to menopause, they become more insulin resistant. So the more that you can address this and also maybe tease apart the role of trauma, the role of toxic stress, how that's contributing to insulin resistance, I think that's really critical. And I can tell you, I've got my little continuous glucose monitor on, and I can tell you that, yes, the food is super important. So eating the right food to keep my blood sugar stable, but so is stress, because stress can change my glucose by 20 points. And we've got to consider that. It's not just the food that you're eating. It's also, kind of this more holistic view of how you're architecting your life.
I was wearing one a couple months ago, and I don't have one on right this second. And again, my sweet spot, I think around yours, like like 70. I don't want to go above 110 two hours postprandial, and I pretty much always keep it in that zone. But one morning, I was running out the door to go meet a bestie, and I was in what used to feel like, what I had mistakenly called my zone of genius. Like I was in full, sympathetic nervous system, but it felt good. I know that I was once upon a time addicted to stress, and I thought it was a superpower. That's how trauma had really impacted me, where I was like, oh, I'm just going to borrow from myself for as long as I can. And so I feel good. Like I'm in this joy state, but I'm like handling business, taking care of my son and doing the things and getting ready and running to a friend. And I measure it on my way, and I hadn't had anything to eat yet. And it had spiked. It had spiked 40 points. 40 points. And I think it was one of the biggest spikes I had seen in months, like months. And I thought, oh my gosh, like this was who I was 24/7 years ago. Like this is just who I operated as. And I just tapped a little bit into that energy, and oh my goodness. And so it was so profound to see that on the continuous glucose monitor. Had I not had one on, I honestly would not have known.
Such a good point, because, oh my gosh, you said so many things that I want to unpack. There's a way that what we think is our zone of genius is actually a dysregulated state.
Mm-hmm.
And that was also true for me. As much as I didn't want that information, I feel like what happened for me is that, I entered dysregulated states when I was a kid. I have an ACE score of 6. So I've got, yeah, so you and I have a pretty high load. That's pretty high. And so my body became adjusted to that dysregulation. And it was a way that I would feel alive, to have kind of all of these inputs and trying to manage all of these people. And I felt like, okay, I've got this down. But that became a set point for me. And there's a cost to it. there's certainly the blood sugar cost. There's a way that it keeps you, as you described, in sympathetic activation. So that on button of the autonomic nervous system, fight, flight, freeze, fawn, especially in women. And it keeps us out of the parasympathetic nervous system, which I now think of as stay and play, rest and digest. But I really like stay and play. And so knowing this, it took a wearable, like a continuous glucose monitor, for you to notice this. And
Mm.
I imagine it got you to kind of step into action, because a 40-point rise is not good for your blood vessels. It's okay once in a while, but to have kind of that constant exposure to your blood vessels and to get that, kind of non-classical autoimmune response to your blood vessels, that's not good over time. So hats off to you for recognizing that. And, most people would think getting ready to go meet a bestie, like that's your best physiology possible. And I imagine your glucose really stabilized after you got together with your
Yeah.
girlfriend, right?
Yes.
But on the way, there's some issues that have to be addressed. There's issues in the tissues, as they say.
Yeah, it was so fascinating. And I had known that, my default way of, my pattern and my nervous system had kind of operated in that way. And obviously I'd seen the profound negative implications of that. Again, the severe chronic fatigue at 30, then the Haji's diagnosis, and so I don't know if this is you too, Sarah, but I am very intentional. I have to be so intentional every single day to not go into a reactivated default sympathetic mode. And
Yes.
and I don't know if I've done a lot of meditation retreats. I've done I've done a lot of things to really kind of break. I'm about to start internal family systems therapy and with a really amazing trauma informed therapist. But what I've learned, at least up until right now at this moment in my life, that every day I am intentionally making choices to ensure that I don't go into an automatic way of operating that really served me, I guess you could say, or tried to serve me. I always want to be so grateful for that part of myself, that little Mariza, whether she's 4-year-old or 12-year-old. I don't know. They're always trying to get in front of. They're always trying to drive the bus, and to keep me safe. But that there's so many things I do every day to just tell her I'm okay, I got this, like I can handle this. But then in that little one moment, it was like it wasn't weird energy or like let me go handle things energy. It was like, oh my god, I go see my best friend energy. And even I was like, oh, even that was a default system that came into play. And so that was an interesting thing. But no, I find it is very much a very thoughtful process every day to keep that part of me in check.
It's a critical insight that you had, Mariza, because it's these healing states of consciousness that you actively choose over the default, over kind of the trauma motivated default. That's how you really heal. And there's so many ways to do it. Meditation, as you described. I've been a meditator, yoga teacher for 50 plus years. And even that, which has helped me so much over the course of my life, wasn't enough to really start to resolve trauma. So it was helpful. And I have to kind of be on my game. But I could also tell you, in the course of a typical day, I would do yoga in the morning or meditate. It would get me, a few hours of feeling like I wasn't overly sympathetic activated. But then I would kind of get back to this default pattern. And it really wasn't until I started to address those issues in my tissues, the trauma that, the signature of trauma that was still in my system, which I think we become even more acquainted with in perimenopause because it leads to things like rage, anxiety, depression, Hashimoto's. some other autoimmune diagnosis, unless, sometimes we get this divine message that we really need to address our trauma in a whole new way.
Mm, mm,
And that drew me to holotropic breath work to try that for the first time. It led me to start to explore plant medicine and psychedelic assisted therapy. And I even started a therapy program. I started learning how to do Hakomi, which is a somatic mindfulness based form of therapy. So I really appreciate this point that if that's your default, as a result of trauma or whatever has gotten you to that default place, we have to be open to the possibility that we've got to get the right dose of these healing states of consciousness to really allow ourselves to process, feel the pain of our trauma, not numb out anymore, and kind of walk that journey of resolving the signature of trauma in our system.
I agree. I feel like I've gotten another message. I was telling you about it before we got on. I was like, oh, okay. There's my body telling me again. Um, it's really interesting. The intelligence of the body letting you know that, girl, you got more work to do.
I get that message all the time. You think you're going to graduate at some point? No,
No.
the lesson just changes.
It's so true. It's so true. Yeah, I was telling you about my I'm in the process of identifying if this is a concern or not. And but I remember getting the call, and I was like, huh, okay. I was like, this is my body communicating with me once again, and really the immune system communicating with me. Um, yeah. And I agree with you. And I'm so grateful that you dive into this in the book, in your own personal journey, and that you're sharing this journey as well. I'm really excited that I get to dive more into healing these parts of me that are still holding on. I know that trauma lives in our body. It's in the energy of our cells. And it really does continue to show up until we are really doing the work around it. And you're right, I don't know if that's ever done. I don't think it is.
Well, it's a beautiful commitment,
Mhm.
to say, I want to do everything I can to resolve the way that trauma lives on in my body so that I'm not reactive in my relationships, so that I'm really able to be utterly present. A lot of people speak to that. They say, yeah, I want to be more present. They make a New Year's resolution around it. But utter presence and being embodied, being fully in your body, not just hypercognitive, those are some of the indicators that trauma is not running the show. Knowing that your heart rate variability is the best that it can be, knowing that your blood sugar is optimized, knowing that your relationships are full of love and healing, and that you're able to be fully of service. Like, these are some of the indicators that we want to be tracking, because you don't want to be fully of service in a way that overfunctions
Mm.
and depletes you and leads to burnout. Like, that's the old way. We don't want that way anymore.
How is that? I'd love to hear, how has that shifted for you? You're a mom of two beautiful young women. Your partner, you have a partner, so you're in a marriage, and you have amazing friendships and connections. And here we are. The new book is coming out. We know what a launch looks like and feels like. I'm curious for you, what is this looking like for you? Someone who, has got a big voice in the world, is serving millions of people. Like, how has that shifted for you in the last, even maybe even post pandemic?
It shifted a lot. I really appreciate the question. First of all, when you were talking about your toddler and kind of one ear listening to him as he was dealing with something and crying, as a mother, that never really goes away. My older daughter reached out to me last week because she had a colleague at work that was let go, and she was just really devastated about it, and she wanted to talk it through. So the mothering still continues, and that continues to be so critical. I would say what I brought to it more recently is really making sure that I'm a clean mirror, for their experiences and for showing up without bringing my own stuff and my own projections into that relationship. The other way that it showed up is that I had an empty nest. So my youngest went off to college last summer, and I realized that my marriage of 20 years wasn't working. And, I don't want to talk too much about that because I want to be respectful of him, but we went through a divorce, and it was really difficult to do that consciously and to do it in a way that felt equitable. But those are some of the decisions that a lot of people are facing, especially when you've got an empty nest. And then the last thing that I want to speak to is that my tendency with taking care of patients, with launching books, with writing books, is that I power through.
Mhm.
And I know you're going to recognize this behavior, right? Just like, as you said, I'm the horse that you should bet on because I get things done, right? Like I'm someone who's got the task list of 29 things and I just power through it. Doesn't matter how much sleep I get, doesn't matter, what the cost is of it. And I'm not willing to do that anymore. That's kind of the drill sergeant approach. It's a bit of I think of it as kind of an immature masculine approach of just get the work done no matter what the cost is. And now, instead of that top down approach with the dictator sort of saying, here's all the things to do today, I'm doing more of a bottom up approach, which is what am I noticing in my body? Okay, I've got some discomfort. I need to address that. I need to, get some movement. I need to get some exercise. I need to take care of my body first and foremost, put that first before all the tasks that I need to complete. So I've really shifted to more of this bottom up approach instead of the top down. And, I'm still a beginner learning how to do this. And I feel like I need to really understand. I wrote about this quite a bit in the book, like how you do this. But one of the things I noticed when I was in more of that trauma state of the drill sergeant, and why am I talking about this so much? Because I imagine so many of our listeners are doing the same thing.
Oh, yeah.
And what I recognized was that I was so dissociated, Mariza. I was so dissociated. I would just kind of come upstairs. If I had a problem, I would kind of figure out the cognitive solution. I wasn't fully embodied. And the bottom up approach is to really recognize that and to understand dissociation, numbing out is not a way to live. It is a trauma response. And it leads to difficulty in marriages. It leads to difficulty in, kind of a mother child relationship. And it leads to burnout. And that's not how I want to conduct my life anymore. Life is too short.
It really is. It really is. That's so true. Thank you so much for sharing, one, that really powerful realization. And, in all of the beautiful work that you've been able to do for your body, with your body. And, I in that and the knowing that there's no diploma at the end of
There's
it.
no diploma.
I want the diploma. I'm so used to the diplomas. And I'm just kidding. but that, and I just, that's why I wanted to, I'm obviously we could get into what are the gut healing foods and, what are the lifestyle changes but I wanted to speak into what I consider to be that silent, not that insulin resistance isn't silent or blood sugar, rising isn't silent, but I feel like the silent is that trauma piece that is a driving force of how we show up every day. It's such an automatic response that is celebrated and rewarded and diplomaed.
It's
That
diplomat, and then that reinforces the behavior until you either have a scary diagnosis, right? Or you realize I just can't live this way anymore.
yeah. I'm so grateful that you wrote this book. I know you'd been in the process of writing it for a little bit. And I remember holding you in just the highest energy I just knew how profound this book was going to be. I knew you were in Santa Cruz writing it sometimes. And that's what I kept envisioning, is just holding you in that highest space and that highest energy. Because I knew that was not only a part of your healing journey, but also, a big part of the healing journey that you are serving with your patients, and the healing journey that so many of us get to benefit from this under $30 book. Because isn't that amazing?